over 2 million women and girls in Nigeria still experience poor access to healthcare services in the world. So when it comes to sexual reproductive healthcare services, maternal healthcare services, even extending to newborn care, there is a large gap that still needs to be covered, that still needs to be bridged when it comes to rights and appropriate healthcare services. And this is what the SIMBIHealth project is really about.
Understand that if you say you want to go and learn tailor without school, you are going to be only the ironer, but you will not sew.
Through the SIMBIHealth Advocacy Project, the Slum and Rural Health Initiative is spearheading sustainable change in Nasarawa State, Nigeria.
SIMBIHealth project was aimed at mitigating the issues surrounding sexual and reproductive health rights of women in total local government of Nasarawa State.
SIM provides comprehensive training on addressing prevalent health challenges. These women then conduct advocacy visits and forge collaborations with governmental entities to effect the desired transformative changes.
When we started the SIMBIHealth project, our plan was not to take a typical style and approach that is usually more linear and really would not lead to lasting change. And the reason why we've done this is that our team will reflect on the needs of women in Nigeria. Millions of women in Nigeria struggle to access adequate and quality sexual and reproductive healthcare services, and also they are at risk of gender-based violence and really at the bottom pit of gender inequality in Nigeria.
Of course, what we did was to use the people in total local government to solve their problems. So we selected a woman leader and a supervisor across 10 communities. So 20 persons were trained by resource persons, health specialists from the total general hospital. Those persons were trained for 3 months, and in turn they were expected to go and train people in their respective communities. So they went back to their respective community and formed women group. At least 500 women group members were formed across these 10 communities, and they were trained against their peculiarities that they were facing.
The definition of gender is not good because all genders have their own rules and regulations. They have all what they are supposed to know. A lady can also participate in politics, decision making. Each and every decision that's supposed to be taken at home, she's supposed to be part of it. Not that only male child can only be doing decision making. A girl education is very, very important because when you educate the woman, it's like you educate the nation.
This is why when we were designing the solutions, we were determined to ensure that the solutions that we build have a lasting change on the lives of the women and even the communities around. With this insight, we developed a multifaceted strategy to ensure that the solutions that we build have a sense of ownership and are also sustainable.
From training to advocacy and ultimately driving tangible change, SHRIN is at the forefront of improving health outcomes in slums and rural areas.